So I am Rachel Byers, and I'm a project coordinator at the Institute for Disability Research Policy and Practice. And I am incredibly passionate about health care access and health outcomes for people with disabilities. A little bit of background as to why, because I think it's important, is I ended up kind of on accident finding a job in residential habilitation services for people with disabilities. And I worked there for about a year and had a front row seat to seeing how health outcomes were different and interactions with healthcare providers were different. And it struck me there was so much work to be done there. So I went back to school and got my MPH, my Master of Public Health, and decided to continue focusing on that healthcare access and health outcomes component to make sure we could improve the system, hopefully, eventually. So it was clear to me that people with disabilities, especially in those residential services, were facing more difficult health problems, had more chronic health conditions, and that's even more complicated when you are limited with your ability to pay for health services and access to resources that generally help improve health. So diet and exercise, those are more complicated. And it was just very obvious that there's a lot that we can do to support people with disabilities more. And some of the most important things that we found are that in a younger age group, so 18 to 44 years old, there were significant differences in prevalence of the chronic health conditions by race, but that gap disappeared when you got into the two older age brackets, which are 45 to 65 and then 65 and older. So we wanted to know where we can intervene, where are the important differences and where should we focus our resources. That was definitely more policy focused, so we shared that information with policymakers in Utah and just said, here's what we know, here's what we've learned from the data that we have, and we would love to see you use this in consideration when you're deciding where to put money this year. So the policy recommendations, our relationship with legislators here in Utah, we aren't able necessarily to give very specific policy recommendations, but what we can do is say, here is the research and it supports this kind of intervention. So we encouraged paying attention to money being placed in healthcare interventions or preventive healthcare, making sure that there is emphasis on these groups that have higher rates of chronic health conditions and that they're considered when they're deciding where to put emphasis in funding.